posted on Moodle, and I also have pictures from the previous year posted on Moodle of these same exercises. So we're going to run through them. I'm not going to print these off and bring them in. You can pull them up on your devices. You can take notes. You can do whatever you'd like to do. But this is the list of exercises that we're covering for basic, intermediate, and advanced. And these are the exercises that we would expect for you to perform on your lab exams. Okay? So remember what we talked about with basic, intermediate, and advanced. So on our list, we've got stretching to start off with. So I have on here, keep it very clear that if we're trying to gain flexion, so if we're trying to gain knee flexion, what's going to be tight, potentially limiting our flexion?
Hamstrings.
Quads.
I mean, not the quads.
Can someone lie face down for me? So if I'm trying to bend Anna's knee, what might be the barrier to what's going to become tight if I'm trying to perform range of motion?
Quads.
Okay, so the knee extensors are limiting knee flexion range of motion.
So keep that in mind. So we can say it in two different ways. We can say we're trying to stretch the knee extensors, or we can say that we're trying to stretch to gain knee flexion. So if someone is lacking in knee flexion, we're going to stretch knee extensors to try to gain more flexion. Okay, so our flexors are agonists, and our extensors are antagonists, because they're trying to fight. I don't want you to flex. My antagonist. I don't want you to flex.
When it's
so
a question,
opposite muscle group.
Just do it. Where do you feel the stretch?
Exactly.
Where do you feel it?
Knee.
Well, in the front or the back?
In the front.
Okay, so when you're not sure, do it to yourself. You'll feel it.
Okay. All right. So on our list here, so our basic stretches. So we've got two things listed: a non-weight bearing passive knee flexion stretch. So non-weight bearing means I'm not putting weight on my leg. I'm just going to have someone lie down or sit, and I'm just going to have them try to flex their knee. So, Anne, if you're already lying there, if I could get you just to lie back on your back, please, in supine. So if I'm trying to get more knee flexion, I'm just going to say, all right, well, let's not bear weight. Let's just have her pull her knee up and try to gain more flexion here.
This is an open kinetic chain activity. Remember that term?
So we're just letting gravity help pull her down. We're just trying to gain flexion that direction. Okay? And then our second one, you can go ahead and sit up, thank you, is a seated passive knee flexion. So if I'm in sitting, and you guys are on stools, so you can even scoot a little bit, and I need to gain more knee flexion, so keep your foot where it is, but now scoot your stool over top and try to pull your foot back behind you. Okay? So someone who is limited in knee flexion can just scoot forward in their chair and try to gain knee flexion. These are very, very low level. This isn't for someone who's an athlete or someone who's just, maybe twisted their ankle or twisted their knee a little bit and they're not really that injured. Or this is someone who has some significant issue, something significant that's keeping them from gaining their range of motion. So just by sitting, I can pull my foot underneath me to gain knee flexion. And then I can scoot my chair or scoot my backside forward so I'm over top of that leg. And then once you get to a stuck point, you can actually tap the foot. And that'll usually give you a little bit more, and I can scoot back over top of it a little bit. Okay, so all of you who are in chairs, I want you to put your feet flat on the floor. Okay, I want you to pull your foot behind you as far as you can. Scoot forward on your chair. You don't want to be. Okay, so just scoot your heel back underneath you and feel. All right, I get so far, and I don't really want to flex my knee any further. I'm at my farthest point. Okay, and then you can scoot yourself a little bit forward over top to gain a little more knee flexion. You get so far, you can tap the foot and often sneak a little bit more. Right, you get so far, you can't. So
Yeah, I was looking at. I'm like, how are you gonna tap your foot? You're already.
This works very nicely for people who are
like tap your
post-surgical,
toes.
who are just starting some range of motion. So that's basic. You're not really bearing any weight. It's very, very basic, very low level, not super taxing on the body. Okay, so intermediate. Now we can do a standing knee flexion stretch with a hand or a strap. Okay, so be particular with your form. As PTAs, you're going to see a lot of really sloppy form, and it's job to make sure we teach our patients clean form and that we do correct them. Okay, don't just go, that looks close enough. We want to correct them. So if I'm standing, I can't do this leg, but if I'm standing up and I try to do a standing flexion, well, I'm at soft tissue approximation already. I can't go any farther with my muscle mass. And if I grab this leg and I pull, or I grab my foot and I pull, see what happens to my knee because I'm tight? I'm already swinging out to the side into abduction. We want a pure motion, so yeah, exactly what Tim's doing. He's grabbing with his opposite hand, or if you need a strap or a towel, grab with the opposite side. That's going to keep you from twisting. This is cheating. This isn't stretching my knee extensors. That is twisting. You're not in the right position. So everybody stand up, and I want you to grab your heel. And if you can't grab your heel, that's where we use a strap or a towel and wrap it around the ankle.
You do a little down here.
Get to the right one. My hands through
I
cramps.
do this crazy without hurting myself.
Okay.
Help there, PTA.
So then if you can't stand, this is also a modified position. So Brian's in supine, but take your strap to the other side so you're not pulling leg up to the side. All right, so you can have someone lie in a prone position, use a strap, towel, or even reach behind. If you're worried about their balance, that they can't just stand and do it, or you don't trust that they can hang on and do a standing stretch at the same time. Okay? But also keep in mind you want to keep your tail tucked under, whether you're standing or any position. This way, Brian can't really cheat and flex his hips in the prone position, but standing, you'll oftentimes see people do this as well. Well, if my hips flexed, this is a two-joint muscle. I'm cheating. I'm not going to get full. I'm not going to get a full passive insufficiency. So what I need to do is keep my hips tucked under as well, so I'm not shortening that hamstring at the hip. Make sense? All right. Perfect. Okay. So advanced. All right. Advanced, you're going to hear some themes. Advanced is really only going to be maybe sport-specific, work-specific. These are going to be more ballistic motions. So you'll oftentimes see people before a sporting event doing some sort of dynamic stretching where they're swinging their limbs. Exactly. They're doing some sort of a swinging motion because they're getting ready to do a sport where they have to take off and do something quickly that's going to be maybe plyometric. So they're going to do more of a ballistic type stretch because they need their muscles to be able to react and stretch that manner. If we just have them doing a static stretch, that's not going to be enough or appropriate for them before they're getting ready for their event. Yes?
Is the difference between ballistic and dynamic more or less the speed of it?
Dynamic is definitely some sort of a movement. Ballistic oftentimes is a little more plyometric where you've got to spring back. Very, very similar though. Very, very similar. So ballistic, you'll see it has a repetitive quick motion. So doing things ballistic or plyometrically, it may be a spring repetitive. Where dynamic might just be one time doing something quick. Exactly. So you're oftentimes going to see more of the repetitive, exactly what Anna was doing, maybe not just this, but adding a little whip to the end. So I can really feel a stretch doing that dynamic or that ballistic motion. Doing a lot of yoga poses. Think about how much stretch you get. You're holding, it's dynamic, but it's not necessarily repetitive. But I can get into several yoga positions and really feel stretch. But those are going to be more advanced. That's not what you're going to give to your basic new patient who either doesn't have the strength or doesn't have the motor control or the ability to do those positions. Okay, make sense? Good. All right, so just the reverse. Now, if we're stretching to gain knee extension, okay? So knee extension, I need to straighten out my knee. Now, which muscle group am I stretching? Which is my antagonist?
Hamstring.
My knee flexor is my hamstrings, exactly. So we're stretching the opposite to gain that motion. So with our passive, we've got a non-weight bearing passive knee extension stretch. Exactly. I'm not bearing weight on my leg. I'm just sitting. Same thing here, if I keep my pelvis tilted back, this is a 2-joint muscle, and I'm not getting nearly as much stretch. So even all of you that are sitting down, prop your heel out in front of you, and just roll back on your pelvis. See how much stretch you get there? Not much. You've slacked up one end. You've negated your passive insufficiency. But now if you roll up and sit up on your ischial tuberosity, sit up on your sit bone, now that elongates a little bit, okay? And then you can add a little more by pulling your toes back towards you. So then you get even more knee extension, okay? Can you feel that in your hamstrings? Okay? So that's non-weight bearing. This is very safe for patients. They're not at much risk here in the very basic stages, okay? If someone is a little bit tight, so we had a few people, I'm slipping here, but we had a few people that maybe weren't fully to 0. We had a few people, maybe that are not quite all the way straight to gain those last few degrees of extension, or even if they're really, really flexed to gain extension. Just doing a quad set, so just by actively engaging my quad, so if you're in that stretch position, just now engage your quad.
Oh, yeah.
Just an active quad set automatically kicks in some stretch to that antagonist, that hamstring. So very, very simple. These are things people can do very easily, multiple times through the day. Just a little quad set is going to stretch your hamstring on the opposite side, your antagonist. All right, so those were basic. So now for intermediate. Low load, long duration heel prop, or prone knee extension. So if I want to do a low load, long duration, I'm typically going to have my heel propped on something, the back of my leg open, so I could be on the couch and my heel kicked up on the coffee table or an ottoman with the back of my knee open. Add just a little bit of weight, a nice ice pack if it's a knee injury, or a little hand weight, or a little cuff weight. And just sit there for 10, 15 minutes, however long is needed. And that weight will slowly, slowly help extend the knee. Okay. So I can do that in this position, so I'm upright with my heel propped. Or I can get in prone. So if I'm in prone, now I can hang my leg. If I didn't have full extension, I can hang my leg off the end of the bed. And I can sit and watch TV for a while, or read a book, do whatever it is I want to do, and I can slowly use gravity to help assist me to stretch my hamstrings into an extended position. Okay, you'll see a lot of this post-surgically. After my knee surgery, this was something that I did a lot to try to get my knee extension back, because that's pretty important to get that back as quickly as possible, or else you see people that are walking around a little bit crooked because they never got their knees straightened all the way. And it is so much harder to get those last few degrees of extension after it's been a little while. So these are readily used exercises. So depending on which position a patient's more comfortable in. So this is a little riskier with my open chain, with my leg hanging off the bed, than if I were sitting with my heel propped up on the ottoman. Okay, so if it's somebody that you're not quite sure about their judgment, or you don't know if you want just their leg hanging off the end, or they need a little assistance to get up and move, I wouldn't necessarily put an elderly person in this position with their leg hanging off the end of the table if I weren't sure about their motor control, their balance, to be able to get back up off the bed safely. So I would just have them probably sit with the heel propped on the ottoman. Recliner chairs, sitting upright with a pillow behind their back so they're not slouched. Oftentimes recliner chairs, you've got the pad at the footrest. They can do that, and I'll give them a little weight to put on their knee. Okay. Continuing on, so with our standing knee extension stretching, so we already did this kind of thing. We can do the same thing just in standing. So instead of sitting, we've got our heel propped out in front of us. We're going to straighten the knee. We're going to flex forward at the hips. Okay, anybody that's standing up, go ahead and do this position. So we can do that way with our foot on the ground. We can kick our foot up onto an ottoman, a bench, what have you, up onto a higher surface as you can. as long as they can still maintain that neutral pelvis and not rotate back. If I got any higher than this, I couldn't maintain my neutral pelvis. So you may start them low on the floor and then move them up to a little higher surface as they can. But again, it depends on my person. Do I need to have somebody in this position? Are they going to be balanced enough to be able to stand and hold that position? Maybe, maybe not. We'll gauge that patient individually. Okay? Gonna be all stretched out. Make sure you're switching legs as we're practicing something so you're not just going one. Or go home and do the other side. Okay? And then advanced. Again, hey look, ballistic repetitive foot motions or dynamic. We can do a walking lunge, side lunges, yoga, things like that are going to be a little more dynamic. So again, what Ann and I were doing before is more of a ballistic kind of a stretch that we can get forward and stretch out the hamstrings, doing any kind of more of a dynamic movement, sport specific. A lot of warm-ups that you see that are done, those are just limbering up, getting the blood flowing, stretching while you're moving through quick patterns.